Respiratory disorders are conditions that affect the lungs and the normal process of breathing. Since the respiratory system is responsible for supplying oxygen to the body and removing carbon dioxide, any disorder affecting this system can significantly impact overall health. Among the most common respiratory disorders are asthma, bronchitis, and pneumonia. Although these conditions differ in causes and effects, they all interfere with normal respiration and require proper medical attention. To understand respiratory disorders, it is important to first recall how normal breathing works. During inhalation, air travels through the airways into the lungs and reaches the alveoli, where oxygen enters the bloodstream. During exhalation, carbon dioxide is removed from the body. Any obstruction, inflammation, or infection along this pathway can disrupt breathing efficiency. Asthma, bronchitis, and pneumonia each affect different parts of the respiratory system, leading to characteristic symptoms and complications. Asthma is a chronic respiratory disorder that mainly affects the airways. In people with asthma, the airways are highly sensitive and react strongly to certain triggers such as dust, pollen, smoke, cold air, exercise, or stress. When exposed to these triggers, the muscles around the airways tighten. The airway lining becomes inflamed, and excess mucus is produced. This combination causes narrowing of the airways, making it difficult for air to move in and out of the lungs. As a result, individuals with asthma often experience symptoms such as wheezing, shortness of breath, chest tightness, and coughing, especially at night or early in the morning. During an asthma attack, breathing becomes labored because less air can reach the alveoli for gas exchange. Although asthma cannot be completely cured, it can be effectively managed with proper treatment, including inhalers that relax airway muscles and reduce inflammation. With correct medical care and trigger avoidance, most people with asthma can lead normal, active lives. Bronchitis is another common respiratory disorder, but unlike asthma, it primarily involves inflammation of the bronchi, the large air passages that carry air from the trachea into the lungs. Bronchitis can be acute or chronic. Acute bronchitis is usually caused by viral infections and often develops after a cold or flu. Chronic bronchitis, on the other hand, is a long-term condition often associated with smoking or prolonged exposure to air pollution. In bronchitis, the lining of the bronchi becomes inflamed and swollen, and excessive mucus is produced. This mucus narrows the airways and blocks the smooth flow of air. Jets. As a result, individuals experience persistent coughing, often with mucus, along with breathlessness, chest discomfort, and fatigue. Because the airways are filled with mucus, oxygen delivery to the lungs becomes less efficient, making breathing more difficult. Pneumonia is a serious respiratory disorder caused by infection of the lung tissue itself. It can be caused by bacteria, viruses, or fungi, and can affect one or both lungs. In pneumonia, the alveoli become inflamed and fill with fluid or pus. This fluid accumulation prevents proper gas exchange, significantly reducing the amount of oxygen that enters the bloodstream. People with pneumonia often experience symptoms such as fever, chills, cough with phlegm, chest pain, difficulty breathing, and extreme weakness. Because oxygen exchange is impaired, pneumonia can be especially dangerous for young children, elderly individuals, and people with weakened immune systems. In severe cases, pneumonia can be life-threatening if not treated promptly. Treatment for pneumonia depends on the cause. Bacterial pneumonia is treated with antibiotics, while viral pneumonia may require supportive care and antiviral medications. Rest, hydration, and proper medical supervision are essential for recovery. Early diagnosis and treatment greatly improve outcomes and reduce the risk of complications. Although asthma, bronchitis, and pneumonia affect different parts of the respiratory system, they all disturb normal respiration by limiting airflow, reducing oxygen exchange, or increasing the effort required to breathe. These disorders highlight how delicate and vital the respiratory system is, and why maintaining lung health is so important. Theme. In conclusion, common respiratory disorders such as asthma, bronchitis, and pneumonia interfere with breathing in different ways but share a common consequence: reduced efficiency of respiration. Proper medical care, early diagnosis, and preventive measures such as avoiding pollutants, maintaining hygiene, and strengthening immunity play a crucial role in managing these conditions. Understanding these disorders helps us recognize symptoms early and seek timely treatment. ensuring healthier lungs and better quality of life.